Medical distrust is on the rise in the U.S. Most recently, pregnant women are pushing back after warnings from the White House linking acetaminophen to autism. We first brought you this story a few weeks ago when the Trump administration made an announcement advising pregnant women to, quote, tough it out, saying they should abstain from taking over-the-counter painkillers such as Tylenol because it could cause a risk of autism. Many medical professionals, however, say there's no substantial evidence proving this claim to be true. This morning, KSHB 41 News reporter Zoe Trask is following up with another perspective. She shares the voices of experts and parents who say medical claims from politicians have the potential to politicize, misinform, and ignore maternal health. Zoe, good morning.
Good morning. Let's start with the stats. A 2025 Gallup poll shows how people in the U.S. would rate the honesty and ethical standards of people in different occupations. Ranking at the highest percent are nurses at 76%, second, pharmacists at 57%, and medical doctors at 53%. But if we look at the lowest numbers all the way down here, members of Congress and lobbyists both rank at 8% or less. For decades, pregnant women have been taking Tylenol to soothe complications like fevers and headaches, as it is the only doctor-approved painkiller for them. Carrying a healthy child to term can be a challenge for many women, especially first-time moms who may be fearful and uninformed. I spoke to a nurse practitioner and her patients from Uzazi Village. It's a nonprofit in Kansas City that aims to decrease maternal and infant health inequity among Black and brown communities. They say women's health is often sidelined in U.S. history. For example, Missouri voters backed abortion rights in 2024, but a Cole County judge approved ballot language this month for a measure that could reinstate abortion restrictions.
I think it does show a pattern, and it also helps guide continued mistrust. We are trying to build a platform where women want to get care, whether they are Black, brown, or other.
Less than 100 years ago, women couldn't even vote. And so it's just, I don't know, I feel like America has a history of not treating women as the equals. And so it's very important that we give them that voice and that confidence to make their own decisions.
And I don't think that there's any way to be 100% prepared to have a child, but I do think that if you are surrounding yourself with people that are not only uplifting you, but also loving you, that really changes the trajectory of things.
I also spoke to a pregnant woman living in Kansas City. She says it's important for women to feel like they're in control of their own bodies. By conducting her own research and putting her trust in a credible doctor, she feels more confident in her pregnancy journey.
It really should be between a woman and her doctor what medical decisions that she should be making. And without all of the context, it can be really dangerous to tell somebody not to take a certain medicine that might be right for them. Because I'm the expert on my baby, and it's important to me that I find people around me that can give me advice, from doctors to doulas to friends, people that I really trust and that I know trust me and take me seriously.
Jess told me that the Trump administration's announcement hit close to home because her husband has autism.
Well, Zoe, when we treat autism as something that may be harmful or preventable, what kind of message do you think it sends?
Jess told me that people with autism are full contributing members of society just like everyone else. Yeah. She says they don't talk about it as a risk in her family, and all kinds of people have sensory needs, but she says she loves her husband and family all the same.
Zoe, thank you so much for that report.
Thank you.